Chapter 27, the Health Information Technology for Education and Clinical Health, High-Tech Act, Meaningful Use, Medicare Access and Chip Reauthorization Act of 2015. The American Recovery and Reinvestment Act of 2009 is commonly referred to as the Stimulus Act. The federal government began using legislation supporting financial incentives to change how healthcare services would be delivered. The High-Tech Act portion of the Stimulus Act dedicated billions of dollars to change how healthcare providers documented the services rendered and communicated with patients and payers. The challenge for the healthcare system in the United States is to improve the quality of care for patients while reducing the cost of delivering care, and the ultimate goal is to achieve improved health and healthcare outcomes. Bipartisan support continues today with the approval of MACRA, which includes advanced practitioners and requires physicians to expand their use of health IT to maximize Medicare reimbursement. The executive order outlined the federal initiative granting federal dollars to incentivize healthcare providers to implement and use health IT. The executive order created the position of the Office of the National Coordinator for Healthcare Information Technology, with the goal of facilitating the widespread adoption and implementation of EHRs across the United States. The federal initiative was built on 6 key components that have continued to serve as the foundation of the revolutionary changes to the healthcare delivery system. Number 1, ensure that appropriate information guide medical decisions is available at the time and place of care. Number 2, improve healthcare quality, reduce medical errors, and advance delivery of appropriate evidence-based medical care. Number 3, reduce healthcare costs resulting from inefficiency, medical errors, inappropriate care, and incomplete information. Number 4, promote more effective marketplace, greater competition, and increased choice through wider availability of accurate information on healthcare cost, quality, and outcomes. Number 5, improve the coordination of care and information among hospitals, laboratories, physicians' offices, and ambulatory care providers through an effective infrastructure for secure and authorized exchange of health information. And number 6, ensure that patients' individually identifiable health information is both secure and protected. Establishing the ONC through federal statutes instead of an executive order emphasized the fact that this position and its operations were improved and endorsed by both parties in Congress and represented a critical component of the federally mandated strategic plan. The national coordinator duties include standards, HIT policy coordination, strategic planning, the website, certification, reports, assistance, and governance for National Health Information Network. 3001 of the Health Information Technology Act directed the operator to create a strategic plan to address the following federal initiatives: the electronic exchange and the use of health information and the integration of such information, the use of an EHR for each person in the United States by 2014, the incorporation of privacy and security protections for the electronic exchange of individually identifiable health information, security methods to ensure appropriate authorization and electronic authentication of health information, and for specifying technologies or methodologies rendering health information unusable, unreadable, or indecipherable. A framework for coordination and flow of recommendations and policy under the HITECH Act among the Secretary, the ONC, the Health IT Policy Committee, and the Health IT Standards Committee, as well as other health information exchanges among relevant entities. Methods to foster the public understanding of health IT. Strategies to enhance the use of health IT in improving the quality of care, reducing medical errors, reducing health disparities, improving public health, increasing prevention and coordination with community resources, and improving the continuity of care among healthcare settings. Specific plans to ensure that populations with unique needs like children are appropriately addressed in the technology design, which can include technology that automates enrollment and retention for eligible individuals. The Health IT Policy Committee may also consider the appropriate uses of a national health information infrastructure that include for purposes of collection, biosurveillance, medical and clinical research, and drug safety, self-service technologies, telemedicine, and methods to secure access by an individual to such an individual's personal health information. The Health IT Standards Committee will recommend specific standards, the implementation specifications, and certification criteria for the electronic exchange and the use of health information. Certification criteria means criteria to establish that the technology meets with the standards and implementation specifications. Standards and Interoperability Framework is a set of harmonized, interoperable specifications to support national health outcomes and health policies, including meaningful use and the ongoing mission to drive better care, better population health, increased patient engagement, and cost reduction through delivery improvements. The ultimate goal of meaningful use of an EHR is to enable significant and measurable improvements in population health through a transformed healthcare delivery system. The ultimate vision is that all patients are fully engaged in their healthcare and that the providers have real-time access to medical information and tools to help ensure the quality and safety of the care provided, while access is improved and health disparities are eliminated. The purpose of the health IT incentives outlined in the HITECH Act is to promote reform in the delivery, cost, and quality of healthcare in the United States. Eligible entities for the Medicare program include the following: all licensed hospitals that are reimbursed based on the prospective payment system, critical access hospitals. For these hospitals and to be eligible to participate in the Medicare program, an individual physician must have a 30% Medicaid patient population. To encourage healthcare providers to adopt and implement EHRs early, physicians were eligible for Medicare incentives up to $18,000 in the first 2 payment years, and then the amounts declined each year thereafter, with a total capped amount of $44,000 during the entire program. The financial incentives provided through the Stimulus Act are carrots to encourage healthcare providers to adopt and implement EHRs in an expedited manner. Therefore, to obtain Medicare payments, the entity must use certified EHRs meaningfully. The Centers for Medicare and Medicaid Services focused on the fact that healthcare information technology is the tool to achieve improved patient outcomes and population health. MACRA was passed with strong bipartisan support in both the United States House of Representatives and the Senate. MACRA was signed into law on April 16, 2015 by President Obama. In addition to changes in how Medicare will pay physicians, MACRA also extended funding for the Children's Health Insurance Program, or CHIP as it's commonly known, and community health centers for 2 years. CHIP provides low-cost health coverage to children and families that earn too much money to qualify for Medicaid. The 3 foundational stages of the Meaningful Use program are designed to modify provider behavior and transform how healthcare information is shared to improve patient outcomes, supporting reimbursement in the future. EHRs manage healthcare data and information in ways that are patient-centered and information-rich.